Hello and welcome back to the EMDR Doctor podcast. I'm Dr. Caroline Lloyd, and if you are new to this channel, you are welcome. And please don't forget, if you like the podcast, to like and subscribe, because it really does make it a little bit easier for other people to find the podcast. So before I get started today, I am going to talk a little bit about something exciting that I'm doing in about a month or so. So on the 17th of September, I'm going to be presenting a webinar about DID, Dissociative Identity Disorder, with my good friend Dr. Kate Beardsley-Smith. So Kate is a psychologist with a lot of experience with DID. She has a wealth of knowledge, and it's going to be a really fascinating chat. So if you would like to join me, please come to emdrdoctor.com.au/training, and you'll find that training to book into. So that's an hour and a half, 7 p.m. Australian Eastern Standard Time on the 17th of September. I think DID is one of the most misunderstood mental illnesses that we have in our society today, and probably one of the least well recognised. If anyone's ever seen the United States of Tara, or going back a few more years, Sybil, you will know what DID is not. So that was really well misrepresented with both of those television shows. So we're going to be doing a deep dive into what it actually is and how to help your clients without referring on. It's one of my bugbears. We do not need to refer on. We just need to upskill just a little bit and explore with our clients how we can help them. So today I'm not talking about DID. I'm going to be talking about EMDR and chronic illness. So I've just finished reading a paper about EMDR for chronic illness. It was a bit of an old paper. It was written in 2009, but it's about EMDR use in helping people cope with chronic illness and help their families cope as well. So one of my special interests, being a medical doctor, is medical trauma. I think probably because I was in the general practice space for such a very long period of time, I met a lot of people who had been through the system and experienced some medical trauma. And that might be an operation that didn't go as expected, or prolonged periods of time in hospital, or complications that were unavoidable, sometimes complications that were avoidable. And I have to say, medical trauma can sit on both sides of the stethoscope, so to speak. So medical trauma can be experienced as a patient and also as a doctor. So doctors don't like it when things go wrong, and also their colleagues don't like it. So sometimes there is some medical trauma around just being in the medical system, and medical trauma around vicarious trauma, seeing things that are really quite horrific sometimes, trying to help people, and sometimes not getting good results. So there's both sides of that medical trauma coin. Anyway, I'm digressing a little bit from where I want to go today. So I have just read this article about how EMDR can help people with chronic illness, and in particular they talked about neuromuscular conditions and degenerative conditions. So they presented 3 case studies of 3 different families, all of whom had a family member die from a neuromuscular condition, and they explored some of the different ways that medical trauma can happen for people with a neuromuscular condition. And this inevitable kind of march towards death, which is extremely frightening, very disempowering, really causes a lot of stress and tension in the whole family, not just the person who is experiencing the disease. And what we might find with someone with a condition like this is an enormous sense of lack of control, alongside incredible despair and grief and anticipating their own death. And I think anyone with a terminal illness does go through a grief process where they grieve either their own upcoming death or the death of a loved one well in advance of the actual event. And this kind of living with this process can be extraordinarily hard and really disabling, and can really impede someone's enjoyment of the life that they do have left. There can be a lot of frustration and a lot of anger on both sides. There can be a lot of frustration and a lot of anger both at the disease, at the medical powers that be, at staff, at family, at the government even. Sometimes it can be focused on, in Australia we have the NDIS. So at the moment we're seeing a lot of people with disabilities very, very angry at the changes to the NDIS and the potential loss of the support that they have previously been given. So there may be a lot of anger about resources that are not available, or resources that are maybe being taken away. There's grief and loss about the loss of function, the body image, and the whole identity of the person. And there may be quite a lot of anger about the unfairness of not being able to live a whole life. And sometimes in families or even in the individual, there's a sense of failure. Failure to prevent the illness, failure to have a healthy child. Maybe if it's my gene that I passed on to my child, there can be an enormous sense of responsibility and guilt and shame even. And sometimes there can be episodes of care where the carer feels like they've failed the person that they're caring for. Maybe they didn't turn them enough and bed sores developed, or maybe they didn't suction them enough and there were respiratory issues. So maybe they didn't take enough care, even though they took the very best care. There might be this sense of, I didn't do enough, a lot of self-blame, a huge sense of responsibility, and alongside that responsibility, maybe even a bit of a sense of unfairness in the case of the carer, like they may have been thrust into this role without any training, without any knowledge, without any preparation. So with EMDR, I often find that when we delve into the situation, there's often a scenario or a situation or a memory that feels incredibly heavy and very, very distressing. On the carer's part, it might be one of those episodes that I've just mentioned, maybe seeing them really struggle for oxygen or seeing them distressed. It might be coming out of the anaesthetic and seeing the doctor's face, all worried and concerned, and saying, we couldn't get all the cancer out at the operation. It might be a moment in rehab when it became really obvious that the goal was not to get back to previous function, but the goal was a more manageable goal. So there are often moments along the journey that feel horrendously painful. And if we choose to process those with EMDR, if we can remove all the pain and the distress and the bewilderment and the frustration and the anger, if we can remove all of those heavy, heavy emotions from that moment, then often what we get to is, I believe I did a good job. I'm a good carer. I'm a caring, capable person. I did my best in extraordinary circumstances. And for people with the illness, we can often find a way to reach greater acceptance of the situation. And we might be able to remove some of the fear and distress that come out of those particularly awful experiences and those moments of extreme difficulty. And if we can do that, then people are much more able to live their best life for the time that they have. They're more able to find a position of function in the family, to be able to accept care, maybe, to be able to grieve properly without the anger or the fear. So I'm not saying that grief goes away with EMDR, because we can use EMDR to mitigate traumatic grief. But what I tell people is that we can take the trauma out of grief, but we can't take the grief out of grief. Grief is about love, grief is about care, grief is about loss, and we can't change those aspects of the situation. We don't want to take the love away. We can't take the loss away. And so the grief will probably still be there, but it will be less complex and less difficult and less laden with all the other emotions. And I've seen so many examples of EMDR being exceedingly helpful in this circumstance. So if you find yourself in this circumstance, or if you know someone who's going through this, please do suggest EMDR for them. Everybody deserves to live a happy life, even if it's a short life. Even if you have heavy responsibilities, you deserve to be free of the anger and the pain and the resentment and the shame. So if you're carrying those difficult, heavy emotions and you're going through something like this, please do reach out and find some EMDR therapy for yourself. So you can contact me, or you can look at the EMDRA website in Australia, the EMDRAA website. That's the Association of Australia. And on that website, we have a Find a Therapist button, and you can find someone who is local to you. There are also excellent EMDR practitioners who work virtually. So if you are in rural or remote Australia, or anywhere in the world, you will be able to find someone who can help you via an online platform. And if you're interested in DID, dissociative identity disorder, and learning more about it, please come along to my website, emdrdoctor.com.au/training, and book in for the 17th of September. I would love to see you there. All right, I hope this has been helpful to you, and I look forward to talking to you again soon. In the meantime, take good care. Bye for now.